Hi.
Hi.
So I've just been in talking to Dr. Heyman about what we're going to do for this tick bite. I want to start off by saying, again, you don't have Lyme disease right now because we didn't see any of the symptoms, okay? We didn't see the rash, your heart exam sounds fine, and you didn't tell us about any knee pain or joint pain, okay? But what we'd like to do is treat you with an antibiotic called doxycycline so that you don't get Lyme disease, okay? We actually just found a really good paper in the New England Journal of Medicine that showed that 200 milligram dose of doxycycline actually works really well to prevent people from getting Lyme disease. Okay.
Are there any side effects that we have to worry about?
It's a really good question, actually. It's a very rare side effect for kids sometimes to have nausea or vomiting associated with the medicine, but it's like 1 in 100. It would be pretty unusual for her to have any side effects whatsoever.
Okay.
Okay. So there's one other thing I'd like you to do, which is I'd like to send you to the lab to get a blood test today, because that's another way for us to tell whether or not you actually got Lyme disease. So would that be all right?
Yeah.
We'll just do a little blood draw.
When would the results be back from that?
About a week or so it usually takes. So
Okay.
I'll call you with the results. If you don't hear from me in a week, what I generally do is ask parents then to call back just to follow up. So, sometimes things get lost in the shuffle.
Okay. Sure.
Okay. And it's an easy medicine to take. You can swallow pills, right?
Yep.
Yeah, so it's just one pill that you swallow. We talked about the side effects. What I'd like you to do is come back for follow-up for your routine asthma check again in 2 months, okay? And at that time, if you're having any symptoms, we can talk about it then. If you do develop a rash before then, or you start to notice that your knees are really achy or your muscles, any kind of thing that's different from what your normal is, I'd like you to call and come in sooner, okay?
Okay.
All right. Any other
Sounds like a plan.
questions?
I don't think so.
Okay, well, great.
Thank
Well, let me
you.
just go fill out the paperwork to send you down to the lab for that blood draw. We'll fax the prescription to the pharmacy, and you guys should be good to go. All right?
Thanks.
All right, great to see you again. Bye.
Bye.